Tort reform is often discussed as a way to reduce healthcare costs. Big liability payouts mean big premium increases for medical malpractice insurance that doctors have to pay. Sometimes so much that doctors end up leaving a particular jurisdiction or a particular specialty. If malpractice lawsuit payouts could be reduced, the premiums could be reduced, and ideally that reduction would flow through to the patient in the form of reduced fees. It would be a very modest amount, anywhere from 0.5% to 3%, depending on who you talk to. But what would be of tremendous benefit is if the reduction in lawsuits and malpractice could move the medical establishment away from the defensive medicine that it practices today. Extra tests, duplicate tests, specialty referrals. Now, as with anything, there are a few ways you can handle tort reform. One way is to get your state legislature to do it. That's what Texas did in 2003. They established a $250,000 cap on non-economic damages, tightened the window in which a possible victim could file a claim, toughened the evidence standards, and also toughened the qualifications for expert witnesses. I think generally the law has been viewed as a success because it has encouraged a lot of doctors to either move to Texas or return to Texas. But keep in mind that with a cap on non-economic damages, your prime of life breadwinner is going to be the biggest beneficiary of that system. A patient who's very young, like a baby, or a very poor person is not going to see a lot of benefit with that cap. Of course, there are other ways, 3 of which are mentioned in the Baucus report. The first is something called early disclosure and compensation, where a medical provider gets tort liability if he comes forward and offers a good faith compensation for the victim of the medical error. You can also have an administrative board that makes a ruling on a particular case. That would have an appeals process. You can also establish a specialty healthcare court like we have for taxes and bankruptcy. That would have an appeals process as well. I lean towards the second option, the administrative board, as something that would be the most fair and the least costly. I'm looking for something that definitely gets us away from the CYA medicine that's practiced today. Doctors would be happier, patients would be happier, costs would be lower, we'd all be happier. But we also need something that helps us address medical errors. I know there are tons of frivolous lawsuits out there, fraudulent lawsuits. The term ambulance chaser was not coined for nothing. We also have a lot of people out there who seem intent on holding doctors and nurses to an incredibly high standard, perfection. Doctors aren't perfect. They make mistakes, a lot of them. Just last month, I read a report about hospitals trying to address their infection rates by laundering scrubs for their staff. Before that process was instituted, staff was wandering around doing errands before they came to the hospital and helped sick patients. You even had doctors who hadn't changed their lab coat in a week. I would like to see a system that protected doctors and other medical providers from things beyond their control, but also held them accountable for things within their control, like dirty scrubs.